This year we're doing active release technique, which is a way to get rid of scar tissue. And the laser, it's a red light, it penetrates down into the tissue, but it helps to promote the healing process.
Are you someone who struggles from chronic low back pain? Have you been to the pain clinic and you're still struggling for a better outcome? If your life is beginning to change due to the amount of pain you're having to deal with and it's keeping you from doing what you love, this is for you. If you've tried other things but you're not sure about a chiropractor, we've got options. I'm Dr. Brittany with Lake Effect Chiropractic, and we're here to show you how we work with Cal, who was referred to us from a pain management clinic. And now we've got him back on track, headed to do his 5K walks again, and he's starting to live his life without pain. So take a look and see how we treat him.
All right, so we've got Cal here, and after what, maybe, I think we've been doing like 4 weeks now?
Probably so.
Probably about 4 weeks. He came here from the pain management doctor, and we really worked with some gentle techniques, muscle work, and he went from being able to walk for only 5 minutes before his legs really started burning and kind of quitting on you to, he said he could do 20 minutes. So we're just keeping this train moving so that we can get him back to doing 5Ks like he wants to, right?
Right.
All right, give yourself a hug for me. And we're gonna crunch forward. And you were doing, you know, whether it be, you had some injections. Did you have any ablations done?
I did one time.
Okay. And I mean, there was a little bit of help, a little bit of progress, but you weren't turning any corners and improving.
Right.
So this year we're doing active release technique, which is a way to get rid of scar tissue. And I'm working on the muscles that are right in and around the spine that create the stability and protection and movement. So if we got these muscles woken up, we've started having him do some exercises, which I'll show you. Turn to your left and turn to your right. And yeah, slowly but surely, you know, early on, Cal's like, how long is this gonna take? I said, you know, give me a good 6 to 8 treatments where we start to get momentum, and we're getting close to that, to where he's maintaining, he's at once a week and still improving. So time will tell.
Mm-hmm.
All right, crunch forward. But he put it to the test in other ways, really enjoyed a weekend up north, standing in the water at Higgins, and 3 days of that, and you were able to do what you need to do, getting back to golfing too, without a miserable next morning.
I don't see it always, or being better totally.
Say again?
I don't see it ever being the way it should be.
Right, and that can be,
but it's definitely helped.
Getting your life back, not just sitting back in the recliner waiting for it to pass you by. Good. Turn to the right and turn to the left. Good. All right, so let's go face down for me. Good. Okay. So here, this table is called flexion distraction, and with some of the degeneration and stenosis that he's got going on, this helps to open up the canal where the spinal cord lives, keeping the leggies alive. The decompression pulling that this table creates helps open up the joint spaces, slides and glides the joints. So with Cal, we're not putting him on his side and twisting him in any way, but we get the joints moving using more of this stretching, distracting pull. He's graduated. We worked just like you see here for about, it was 2 visits, and it was slow to really make a lot of change. So I added in this here, the laser. And the laser, it's a red light. It penetrates down into the tissue, but it helps to promote the healing process. We did that for about 4 or 5 visits, and that definitely seemed to help push him over the hump and get to where he's starting to see he could feel a lot better after golf, not crazy sore and stiff the next morning.
Definitely helping. Very happy with the progress we're making.
It's been a real good, slow and steady wins the race, but I mean, when you talk about, you were dealing with this for over a year, kind of on and off, like different treatments, physical therapy.
Started in September of 19 when I got hit by a car.
You were in the golf cart, right?
Yep.
Right, yeah. So, little bump got backed into, and it just hasn't been right since, so. He's been around the block, so it's nice to hear from him that he's feeling progress, because I only saw him initially broken. So, all right, everybody.
Okay, so for Cal, we have him doing some homework. The first thing that we have him doing is repeated flexion. And so there's 2 ways that he can do it. He started out when he was really hurting just by doing knees to chest, laying on his back. So I'll show you that. He does it with repeated movements. So by hugging the knees to the chest, helps to get the low back moving in this direction. And it's the safest position. Very little body weight, and just the movement helps. After a couple of weeks of doing that, he progressed to doing it seated. So we have him sit on the edge of a chair and reaching through his legs farther, farther, farther. And we see that this can help with people who have some severe degenerative disc disease and some lumbar stenosis. The other thing that I have him doing is stretching out the hips and piriformis. He does a lot of driving for his job. So he crosses one leg up like so, sitting tall, and then you hinge forward at the hip. All right, we do about 30 seconds on each side. Holding it, leaning forward, feeling it here through the hip. One thing to pay attention to is don't slouch. Nothing really changes here, but you sit tall and hinge forward. Lastly, we have him doing side planks. We're starting to build up some core strength, and the best way to do these is to think about being on your side, elbow strong and supported. You're going from a seated position here, make believe on my side, but seated, and then coming up, squeezing the butt, pushing the hips forward into a standing position. Hold for about 5 to 10 seconds, and then come back down. You'd repeat this on both sides for a set of 10. Don't waste another day looking for your solution. Here at Lake Effect Chiropractic, we offer non-invasive care, and we're focused on you, the patient, and exactly what you need. So if you're in pain and you're trying to stay active and you're looking for a solution, give us a call today. You're going to receive an exam and a treatment on the same day, so we can get you feeling better as soon as possible. Start feeling better today. Give us a call at 989-686-6808. Look forward to hearing from you.